Well, hello again, everybody. Today is Wednesday, August 12th. Welcome into another Keep Boone Healthy Facebook update. I'm David Jackson with the Boone Area Chamber of Commerce. We're joined with our good friend Jennifer Green, the Public Health Director for App Healthcare and frequent visitor on this channel to provide us some updates and some general talking points on where we are with the community COVID response. So, Jen, thanks for joining us once again. Always great to see you in the opposite Zoom box.
Yeah, thanks, David, for having me back.
I guess first things first, could we start with a case update? What do the numbers look like, and what are you seeing trend-wise here in your three counties as we look at COVID-19?
We are standing today, as of this morning, we've got 335 cases here in Watauga County. 85 of those are active cases, so those are the people that are currently in isolation period that have been recently diagnosed. So we continue to watch our trends. In our neighboring counties, we have more cases continuing. Unfortunately, in Allegheny County, we are working an active outbreak in a farm, and that has really driven up the numbers for Allegheny County dramatically over the last couple of weeks. But we're hopeful that with some more due diligence with us and working closely with the farm that we'll be able to get ahead of that. The trends in Watauga County haven't continued to climb dramatically, but they are still pretty high. They've not decreased. So we'll have to watch them over the next couple of weeks to see how things go.
I know that sometimes people look at that number of hospitalizations on the dashboard too, and understanding that that's a cumulative number, just like the case numbers are. But can you speak at all to again, capacity there? Do you feel good about the capacity that's available in the community? And also, I guess too, it's important to note that with limited hospital resources in this community, there are more than one county probably being represented at those hospitals that are taking COVID patients at this time.
That's right. We do regular monitoring of patients, so the patients may actually be in a surrounding area hospital, not even in our district. We've got the number reported cumulatively because we want to protect the privacy of the patient. Thankfully, our hospitals have been great partners throughout this whole event, and they keep us up to date about how things are going with their capacity and patients that they're serving. So I do have a good feeling about our current resources in our hospitals locally right now.
So another popular topic right now centers around the folks that are making their way back to Boone, students at Appalachian State, Caldwell Community College and Technical Institute, Lees-McRae, just over the border in Avery County. Everybody kind of coming back together at the same time for the resumption of college classes. And with that, some question as to how App State students will factor into the dashboard counts that we see. Are those folks, as you have talked about and detailed for us so well over the last several months, do those folks count, if you will, in our count as we move forward and they're back in our community again?
That's a great question. It's one we get asked a lot. We do count students who are here right now. Of course, we know that many of them have permanent addresses outside of the area, but if they're living here right now, we are counting them in the Watauga County numbers. So we want the community to be aware of that. In addition, if you want to keep track of how things are going on campus, there is a specific page at App State website for COVID-19, and the data that they post actually comes from us. So they're continuing to update their dashboard as well related to cases.
I know that with our population roughly doubling with the return of students here and understanding that there are probably some anxieties out there about just seeing more people inside of a tight community. What is your advice maybe to not only the students that are interacting with our community for the first time again, and also businesses that are looking at people, maybe a greater influx of people coming from outside of our community? What is your advice to them in terms of finding that perfect balance of being able to be safe and responsible, yet also understanding that people are going to move around how they move around, and I guess we've all got to get used to that.
Yeah, I think that we have to realize this virus is One of the challenges is that it hides, and sometimes that can lead to exposures. And we know as we have more people moving about and we reopen and continue that journey, that we're going to have more exposures. But what we really need to do is continue to focus on the 3Ws. We've talked about it. We've communicated a lot. I think people setting an example with your business to expect people to comply and ask them kindly to please wear a face covering and make sure your employees are doing the same thing is very important. We know that wearing a face covering is not something that's always popular, but it is, we've got good science to back up the reason for wearing it. And I would say for those who are coming back to the area, we want you to show your love to our community. You're part of our community. We're glad you're here. And we want to make sure that you're safe and that our broader community is safe. So you can be a big help in that by continuing to make sure you're monitoring yourself, you're staying out of public spaces if you're not feeling well, you're wearing your face covering. And also, I want to say too, being aware of gatherings and, coming together in big groups, that can be a recipe for the virus to spread. So be cautious and aware.
I know your team has worked quite a bit with Appalachian State over the course of the last several months preparing for this moment. We've seen some things come out anecdotally within the community about testing for students that are coming into the dorm settings and some other suggestions for those populations within the App State campus that may need testing. What can you tell us about just how those plans have evolved over time and again, maybe speak to your partnership with App State to make sure that they have the resource in you and you also have the resource in them to be able to communicate effectively when you do need to have those conversations.
Yeah, so we have a team that meets every day right now with a core group on campus. We review current cases. We make sure that whether it's a faculty, staff, or student, they have the support they need to isolate effectively if they're positive, and that we have closed the loop in terms of contact tracing so that if someone has been exposed, our goal is to try to make sure that they get contacted as quickly as possible so that they can also know that, be away from the community where they might expose others, whether that's on campus or off campus, and get access to testing because we know that's very important. I'll say too, one of the things that's going to be very important is to continue having regular communication about the importance of prevention. And we do have a good relationship with our friends at App State in terms of putting out information around prevention. I think we need to keep doing it. And we know that we're all tired of hearing the 3Ws probably. Maybe we've heard it so much that we want to tune it out, but now is the time to tune in, not to tune out. We've got to make sure we keep doing it because that is how we're going to try to stay ahead of this. We do have a regular communication with many folks on campus to try to make sure we're answering questions, that they're getting public health guidance, and that all of our community is being supported appropriately. If they don't have a safe place to isolate or quarantine, that we're working together to make sure that that happens, just like we have with other community residents.
Jen, I know you touched on this briefly a second ago, but the importance of answering that phone call from a contact tracer too. I think people that haven't gotten that phone call may live in fear of that phone call because they know that changes the course of their life for a period of time, that they may have to do some things differently in terms of the way that they move about. But I guess, can you speak some to just how important that is in providing pieces to the puzzle that can help further outbreaks or further cases of infection from happening just by, again, sharing information and sharing that in a timely way so investigators can notify people of possible exposures?
Yeah, well, I'll just say we, over this journey of response, we've had most people answer our phone calls, but we've had some who it takes a while to get in contact. It's so important that if we reach out to you, that you answer our phone call or you return our message, because that time is so critical for us to be able to reach you, make sure you have all that you need, and also make sure that the people you care about, whether it's your friends or people you work with or your loved ones that you lived with, or roommates, that all of those folks get contacted in a timely manner so they can also look out for symptoms, because we want to stop the chain of infection by trying to get you to help us put the puzzle together about who might be a close contact. We realize that, it isn't anyone's fault. It's not about trying to place blame. We call because we want to try to help and because we want to try to help protect the broader community. So it's really critical that people participate in that phone call and they help us with that investigation.
As we look at some other health trends and kind of timely things where we kind of see the calendar sit right now and think to some other non-COVID related public health issues out there. I know it's almost flu vaccine time. We heard from Spencer Hodges on Mind Your Business earlier this week about that. What can you tell folks about that process and maybe not only the importance of it, but how that process may even change based on, kind of COVID medical practices and making sure that people aren't getting exposed to things while they're visiting a practitioner for something like a flu vaccine?
Well, we believe this year is going to be absolutely critical to get as many people in our community immunized against the flu. It's going to be so important. And there are so many people every year that don't get a vaccine, that actually suffer severe illness and can be hospitalized. So if we think back to our concerns early in COVID days, we've been thinking about healthcare resources, and it continues to be a concern for us to make sure that we are maximizing our resources. So it's going to be critical that people get their flu vaccine. I think that we may see some different ways of doing that. We've been talking about maybe doing some drive-through flu clinics for folks to make it easier, but it's going to be absolutely critical. So I hope that by starting early with the communication, and lots of different providers I'm sure will be providing flu vaccine, that more of us will be thinking ahead about how our families can be protected against the flu, because it's going to be more important than ever this year.
I think in those early days of COVID too, so many people started putting off medical procedures, whether they were elective procedures that weren't able to happen at a point in time, to also the simple wellness checks and things that you're doing more on a routine basis to maintain your health over the course of the year. I know that's popular with children right now, with school getting ready to start back, though that's virtual for most folks right now. Still kind of that time on the calendar where you can expect to have that work done and get those vaccines administered as well. But again, kind of give you the opportunity to speak on the importance of wellness checks for all of us, just to make sure that other medical issues aren't compounding on top of what we know to be a disruption in what our normal calendar may look like for visiting our physicians.
Sure. I think accessing your provider right now is really important. If you have children, especially school-age children or preschool-age children, it's critical that they continue to keep up with their immunization schedule. We know that vaccine preventable diseases have continued to be on the rise over the last several years, and it's something that we can do something about by making sure our kids get access to their well visits and immunizations. And I'll just say, for all of us adults, we need to practice self-care and make sure we continue that relationship with our provider, especially if we have chronic conditions. It's really important that we are communicating effectively with our providers, not just if we have a chronic condition. I mean, that's really important. But also, if we just haven't had a well visit in a while, there can be underlying health concerns that your provider is best equipped to be able to help you prepare and address. And that's really important. We don't want COVID to keep you away. There are so many healthcare providers that are doing so much to try to make it a safe environment for you, and it's not time to delay that interaction.
Well, and I could imagine too that with, again, the length of what we have seen from COVID and that response mode that we've all been in our various ways, the importance within that self-care for mental wellness too. And not wanting to take any delay, and just whether it's having a friend to talk to, or having a provider that can provide more specific help and guidance there. Mental health and well-being right now has got to be about as important as it ever has been.
Absolutely, absolutely. And I think that it's part of wellness. Mental health is part of whole person care, and it's very, very important. So, making sure that that's part of our overall plan is critical as well.
Well, Jim, we always appreciate your insights, and thank you and your entire team for everything that you are continuing to do in this constant mode of response to what we're dealing with COVID, but also with all of the other things that the health department tracks on a daily basis in good times, let alone in more challenging times. We thank you for that service, and appreciate the opportunity to talk to you. And I'm sure we'll do it again soon.
Thanks, David.